Hello everyone, this is Dr. Swapnil Chandratre here. In last my video regarding PG in Germany, I talked about all the general stuff about PG in Germany. It's for medical also and dental also. But today's video is more focused about dentistry. Okay, so what is the system of PG in dentistry? All will be discussed in detail. I'll try to share my knowledge as far as I know. If someone has more idea, then they can share their knowledge in the comment box also. So if you haven't subscribed to this channel, please subscribe to it because such information you will not find anywhere. So let's get started. So those who have watched my last video, by now they already know that PG in Germany, it's not like a normal PG. Okay, so it's not a university study. It is not going to be a college study. It is like a practical training. So you don't have to pay any fees to do PG here, and you will get paid to do PG. So it will be like more amount of stipend to do your PG. So basically why it is like that? Because during your PG time you will be working in a hospital or a private clinic. So you are going to help the doctor or a boss, your boss, to earn a lot of money. So that's why you are going to get a lot of stipend for that. So that's a very huge advantage, right? Well, you need to understand first the system, that how to get into the PG. So first of all is that first you require to clear your approbation exam, your KP exam. You need to have a permanent license before you can start your PG. Whatever you have heard anything else, it is false. You cannot start your PG until and unless you clear your KP exam. So that will be your first step. Once you clear your KP exam, you need to find the clinics which are providing you the PG. Now why it is like that? So here PG is generally 5 years course, and it is divided mostly into parts. So for example, if you are going to do orthodontics or oral surgery, then you are going to do 2 years maybe in a private practice, 1 year working in a private clinic of a normal dentist, and then 1 or 2 years will be working in a hospital. So it will be divided like that. In between, your lectures will be also conducted into the university hospitals. Now university hospitals, they don't have too much of the places for all the dentists. That's why they have allowed those dentists who have academically good qualifications and they have their private practice also. So they are allowed to train a student to do a PG. So you can do PG there. Here it's like when you are doing a PG in ortho or OS, here these clinics are only dedicated to that practice. So it's not like a more of a general dentistry. So orthodontic clinics, they only do ortho work. Oral surgery clinic will be doing only oral surgery work. So doing PG in those clinic will be just like doing your PG in the same clinical department at the hospital. So that's why it is allowed there, and it is divided such like that. As far as my knowledge, I may be wrong because I am not doing PG myself. So every state has little bit changes in that rule. So if someone has more knowledge, they can contact me and share their information also via email. I will try to involve that knowledge also later on in my videos. So as far as I know, this is the structure of the PG. So first is you clear your KP exam, then find a position of the PG, and then do PG. Now coming to the duration of PG, duration of PG is generally 5 years here. And coming to the branches, in a clinical branch there are PG only in a 3 branch. One is oral surgery, one is orthodontics, and third is oral and maxillofacial surgery. Now oral and maxillofacial surgery PG is generally 10 years. Okay, so in that not only your oral structures are involved, but your aesthetic structures, your facial structures and reconstruction and all that stuff also comes. So for that, first of all, you require to do your medicine for 5 years, PG in medicine. So with that you get a lot of knowledge regarding anatomy and how to manage the patients and all that stuff. And 5 years you are going to learn oral surgery also. So it is completely 10 years of the course. Yeah, it's pretty long. But those who are passionate regarding this maxillofacial stuff, they can do that. But that's a long thing. Another is only oral surgery. Now oral surgery, it's just like oral surgery which you do in India, right? So it's like your work will be mainly focused on impactions and cyst removals and like implants and all that, whatever you do, like fracture plating. So it's just like normal oral surgery that you will be doing, as I said before, in a oral surgeon clinic or in a hospital if you get a position in a hospital, or you do it in a private practice. The third is orthodontics. Orthodontics is the same. It will be a 5 year course, and you will be doing it either in a hospital or in a private clinic. Now the question comes is that what about the people who have already completed the PG? I have discussed in my previous video that your duration will be decreased. Those who are already orthodontists in their home country, and if they come here and they want to do orthodontics, their years will be reduced, right? So how that will work? So generally when you get this position, once you have that position, you start your PG. Okay, in the beginning you don't know what you are going to get. So you just have to start your PG as a normal student. Then during your duration of your time, your boss will decide that how good you are. So for example, if those person who hasn't done an orthodontics and those who are doing PG, and compared to other person who is already orthodontics, now when they do their work, they already know a lot of stuff, like for example wire bendings or brackets and all that stuff. So your trainer will not have to train you too much. Okay, so you already know the basics, you already have done a lot of work. So that's way they will decide that, for example, okay, you require 2 years of less work, and with their recommendation letter, you have to submit all your curriculum, your PG curriculum in detail, what you have done in your country, with sign and stamp and whatever you have done. So those are documentations you have to submit to the dental council here, and then they will take a final call that okay, for example, you have to do it in 3 years only, someone have to do it in 4 years. So it will be like that. So it's not going to be from the beginning anyone will say that okay, your 2 years will be less, your 3 years will be less. That will be decided later on. So if someone has promised you then that it is going to happen, then no, it's in no one's hand. Okay, it is generally an idea that this way it will work, but you need a good amount of documentation to reduce your years for that. So yeah, it's 100% possibility that you can reduce your years of PG and you can finish it faster. So that is regarding the duration of PG. Now coming to the branches of the PG, as I said, the other one branch is community dentistry, which is a non-clinical branch. I personally don't have a lot of knowledge regarding how to get into that, because it's like a non-clinical stuff, and it's more about statistic and all that. So whatever my sixth sense says that maybe it's not a paid position, because you are I don't know, you are not going to do directly the patients and all that stuff. You'll be doing more of the statistics and non-clinical stuff, and it's like an office job. So it may be a paid thing, and it's also not very popular. So and my personal opinion is that these things are generally conducted in German language. Everything is in German language. So to do a non-clinical PG branch in a German language, it will require a lot and very high amount of German knowledge and very good command over language, which will require a lot of year of work, because believe me, it takes time to be very fluent in German language. So I would not particularly focus on that part. I personally will feel that if you want a good growth and good future, then you go with the clinical branches. Yes, with the clinical branches, earning will be more. It's like your starting salary might start from 6 to 7,000 euros, and then it will go up and up with the percentage system also. So that's a very good opportunity if you want to do PG. Now the question arises that what about the other branches, right? For those who have done perio or pedo or endo or proso, what is about that? Why it is like that? Well, here when the students are generally, when they clear their BDS, okay, their bachelors, they generally are allowed to perform all this stuff as same as in India. You can do all that work, but here the students have a very good exposure. They have done a lot of patients in general dentistry, so they have particular command over this prosthetic and endodontic stuff, so they know how to work that. So they don't require basically to do a PG. they are already pretty sound compared to other countries, so they can perform all that stuff. They are being taught in their college about insurance system and all that stuff, so they are already trained on that, so they only require specialization in that. To do a specialization in these branches, there are also I would say certificate courses which are MSc courses particularly. So these courses are paid courses. Those are not considered as a free courses or a stipend courses. It's like a private courses, and those are paid courses. So it's around 35 to 40 lakh rupees of your fee, and around 1.5 to 2 years. Every branches has their own way. For example, implantology or laser, or if you want to do in pediatrics or endodontics. So every branch has their own these courses, and these are the paid courses. I personally will say, my personal opinion is that don't rush to go for these courses, because it will just give you, it's not like you are going to consider it as an MDS here. It will be just like adding a little bit of your title behind it. It's like MSc or something like that. So it's not like it's like a government PG thing. You are not considered as a PG, but yeah, you are going to learn that, but you will spend a lot of money and time for that. My personal advice is that once you clear your KP exam and once you are working in the same clinic, and if the doctor feels that, for example, if he wants you to learn for example microscope in dentistry, then such kind of short courses are also available, and those paid courses are not that costly also. So those courses are generally being paid by the clinic owner only. They will pay you to do that, and you get the training. So don't rush to go for these certificate courses. Allow the clinic owners decide in which branches they want you to do that, okay, and they will pay for it, and that way you will learn also, and you will save a lot of money and time. So that is my personal opinion regarding these certificate courses. So this is what I know about this PG stuff. It's a little bit confusing, and there is not 100% information out there. So that is what I know, and I try to convey you. If you have more doubts, you can contact me. The link is in the description box. Which way for you to come, whether you should go for PG or not, does it make a sense to do a PG here in Germany? Those all are the questions which can be answered. Okay, you can contact me. The link is in the description box. I hope that many of the people have cleared their doubt with this video, and have a nice day.